Thank you very much, Chair, and thank you, Cabinet Secretary and Professor Leach for appearing before us today. I just want to go into a little bit more detail around what you have said around the ministerial implementation groups. When the Secretary of State for Scotland appeared before this committee, he said that the JMC, the Joint Ministerial Committees, had not met during the pandemic and that the MIGs were meeting instead. So can I ask the last time the MIGs met? And I think you're suggesting there's a bit of a vacuum there, but what other collaboration or discussions beyond the meeting with the Health Secretaries are currently taking place?
So it is disappointing that the JMC has not met. I think that there is certainly a feeling on our part that it could fulfil a useful function. From memory, I think the last time the MIG for Health met was 2 weeks ago. But again, I'm happy to confirm whether or not my memory is accurate in that respect. And there is currently a vacuum in terms of shared decision-making, shared discussion and decision-making at ministerial level. Now, the First Minister, I understand, has had calls both with Michael Gove and with the Prime Minister, but there has been no forums for that shared discussion and decision-making.
A couple of people have mentioned the clinical and scientific advice, and that is, as far as possible, done at a four-country level, clearly contextualised for the nations that we are employed to advise. But there are layers of that. Each of the professional groupings, so the 4 chief nurses, talk often, in pandemic and out of pandemic. The 4 chief medical officers talk often. They are meeting in the evenings twice a week presently. And then we have a broader senior clinicians group with about 15 to 20 of us from the 4 countries. Public Health England, Public Health Scotland, the clinical directors of the system, so Steve Powis in England and I, and the chief nurses and the chief medical officers working together to try and make choices and decisions about the advice we're then going to give. So shielding is a good example. So that group would look at which elements of shielding need to be adjusted or need to be added to, and then there would be a smaller meeting to decide should we put dialysis in the shielded group or should we, and then those decisions are made at an individual country level following that individual advice.
Yeah, I suppose the concern for me is hearing that advice, potentially where it's been given to, that there's a disconnect. Now, my understanding is that the MIGs met quite frequently. In fact, the Secretary of State for Scotland said that they were meeting 2 or 3 a day when he gave evidence previously. And I also understand that they are utilised in crisis situations. And obviously, we're moving forward in the pandemic. So, Cabinet Secretary, what's your view in terms of reconstituting the JMC, which should meet on a yearly basis, and indeed one of its primary functions is to help manage disputes or at least divergences?
We remain supportive of the JMC as a route for all that you have described. As I said, we understand that there are to be 2 committees established as a consequence of the MIGs being disbanded, but we don't know what those are, and we don't know therefore how they might relate to the JMC. So I can't really give you a view at this point as to what I might think would be the right route. I don't want to keep repeating myself, but I do think COBRA has an important role, and we should see COBRA working effectively, because although we are moving through the initial significant phase of the pandemic, the point I want to keep stressing is that we are not out of this pandemic. And of course, we, and I imagine elsewhere in the UK, are looking ahead at what we need to do to minimise the risk of a second peak.